So this has to do, of course, with the importance of comorbidities, once again, and sleep is very important as a comorbidity in Dravet syndrome because there's a huge plethora of literature actually telling us that the majority of these patients have issues sleeping and they have issues with daytime somnolence, which can have a secondary impact on the functioning of these patients and their caregivers. But even if 89% of the experts that were involved in the international consensus said that these patients need to have a formal sleep study done, there's no data on the sleep microstructure of Dravet syndrome patients, and there's no data on the effect of seizures and intrathecal epileptic discharges of this microstructure. So on how these patients sleep, how much slow wave sleep they have, how many arousals they have, and if they are linked to seizures at all. So we did a retrospective study on this, and we were able to analyze 63 recordings from 30 different patients, and we found that age is a factor in sleep microstructure in these patients. With older Dravet syndrome patients that have shorter sleep, and they have a less efficient sleep, a lower sleep efficiency, which could be due to their difficulty in falling asleep, so a higher sleep latency that we found in these patients, which is in line with what has been found with the questionnaires in the studies that I mentioned before on sleep comorbidity. And very interestingly, we described a new manifestation in sleep, which is intrathecal epileptic discharge-related arousals. So these patients have an EEG discharge that is then linked to an arousal. So their sleep actually is disturbed by these discharges, which can also have clinical correlates. So they are they're classifiable as actual seizures, which are very subtle and are very difficult to see without an EEG. And these patients had lower, with recordings that had these discharges, had a lower slow wave sleep. So they sleep less profound sleep than patients that did not have these discharges. And actually, these discharges were in 8 patients that we were able to assess before and after the administration of fenfluramine. We found that fenfluramine lowered the number of these discharges, and the patients that were treated with fenfluramine had a lower number of arousals. They had shorter duration of wake after sleep onset periods, and they had a higher amount of slow wave sleep, which is very interesting to see that an anti-seizure medication, and because we didn't find this effect on other anti-seizure medication, but it's very interesting to see an anti-seizure medication that probably has an effect on sleep, both by reducing the amount of seizures and discharges, but also as probably on its own, because fenfluramine is a serotonergic agent, which has been linked to a more stable sleep in animal models also.